Hello, hello, hello. Ooh, that's loud. Hello. Good afternoon, everyone. Very lovely to see you all. It's obviously the hot ticket, this one. So welcome here, and thank you very much for coming. We're here to launch the new Independent Commission for Healthier Working Lives. My name is Jennifer Dixon. I'm the Chief of the Health Foundation, and I'm really pleased to be your chair today. So the Commission, it's set up to look at the key question of why the health of the working age population is so concerning, and also what needs to be done. We know, for example, that about 2.6 million people between 16 and 64 in England are economically inactive and cite a long-term illness as a reason. And there are more, about 3.6 million, we think, are in the workforce reporting a work-limiting condition. So obviously this is a problem for the individuals concerned and their families and their employers, but it's obviously a massive problem for the country, which is why we've had a bit of attention on it recently. And given the current demographic trends with the aging of the population, the shrinking of the working age population, let alone the economy, we've just got to get to grips with this issue. It's a big one, and it's going to be big for some time. We also know that ill health, of course, if working age people, is not spread evenly across the country. There's a huge north-south divide, lest we forget. And also the jump in people who've become economically inactive since the pandemic, including those for health reasons, hasn't returned to pre-pandemic levels, which is very unusual internationally. So what's going on? So this Independent Commission's work is extremely important, and the Health Foundation is extremely pleased to be able to fund it. The enthusiasm we've seen for the Commission is very high, the interest is high, and I think it's demonstrated by we've got a full house today, and also there's a very diverse group of you here, which we're very pleased to see, including people from health and social care, research, policy-making, employers, local government, and the media, among others. So thank you. So what do we want to do? This commission tries to aim to build consensus of understanding of the issues, because without a proper diagnosis, you can't really design the solutions. And then, of course, not just polish the problems, as Jeremy Hayward used to say, but find some solutions that can command some respect, short and long term. So the commissioners will be busy working and reviewing evidence and making recommendations and hopefully influencing action that we all want to see. So today, what we're going to do is try and hear from our panel. Firstly, I'll have Chris Rocks, who's leading the team at the Health Foundation on this panel, this commission. So we'll hear from him first, then we'll hear from our panel. We'll have 5 minutes from each of our lovely panelists, who I'll introduce in a minute. And then we will have a Q&A discussion with you all. And there's a chance to get involved via Slido, which hopefully you can join. I'll tell you about that in a second. Or you can just simply do analog and stick your hand up, and I'll come to you hopefully during the afternoon. So what we'll do is we'll try and finish, we will aim to finish at 17, so that's 5:20. And for those of you who can stay, there are drinks and nibbles at the back. So please network, and they're available until 7, so feel free. So before we get started, just a few bits of housekeeping things. Fire exit the back. No test is this afternoon, so it's for real if it happens. The event is being recorded, so tell your friends. You can watch afterwards and have them do that as well. And a subtitled version will follow afterwards. As I say, you can ask questions, Q&A via Slido, which you can do from now. So please see the slide for the QR code behind me, and you can use that to join the Slido. So you can ask your question, or you can like other people's questions to upvote them and bring them to my attention, so that we can ask the most important questions. And as I say, if you want to stick your hand up, we'll get a microphone to you as well. So if you're not already signed up and would like to stay in touch with updates on the Commission's work, then please do so again by scanning the QR code on your handout. I think it says here. Is that different from the QR on the slide? Someone tell me. I'll tell you later if someone can let me know that. And finally, for the Twitterati, or maybe the Xerati, as it now should be, the hashtag is #HealthierWorkingLives. So before I hand over to Chris to introduce the commission and how it's going to work and the questions and so on, we're going to have a Slido test. So what we'll do is to ask a question first. Here it is. So, people are answering already. How much responsibility do each of these groups have for advancing the agenda of improving working age health on a scale of 1 to 5? Government, employers, individuals, NHS, or other? There we are. So we all think there's a role for the public sector, but obviously employers clearly also have other roles as well. Thank you very much. So I think that means that the Slido works, which is a huge relief. Good. So without more ado, I'm going to introduce Christopher Rocks. Christopher is the lead economist, and he's the head of the secretariat supporting this commission, and he's going to tell us a little bit more of the contours. Thank you, Chris.
Great. Thank you, Jennifer. I think I'm coming through loud and clear. Thank you, everyone. Thanks for being here. It's great to see so many people here today. I think this should be working. It might not be. There you go. Yeah, it's great to see everyone here today. I'll just say, so I'm Christopher Rocks. I'm the head of the team in the Health Foundation supporting the work on our new Commission for Healthier Working Lives. I want to do a few things here, just introduce some of the data around this issue, which I think Jennifer's just touched on, but I'll add a little bit of colour to it as well, and say a little bit more about what we're doing with the Commission as well. Before I start, I just mention, from the Health Foundation's point of view, I sit within our Healthy Lives team, and we're coming at this issue from an understanding that work, and good work in particular, can really be good for and supportive of people's health. But we also know that health itself can be a barrier to work, and it's a complicated relationship we're keen to understand better. And just to kind of get into this first, so this will be an issue which is familiar to a lot of people. This chart shows the change in the number of people aged 16 to 64 economically inactive since the start of the pandemic. And in particular, we draw attention to the red bars here. It shows the number of people saying they're inactive and not participating in the labour market due to long-term sickness. And that figure has increased quite significantly. As Jennifer mentioned earlier, there are around 470,000 more people who say they're inactive due to ill health since the start of the pandemic. So really increasing that number significantly. But I think just to take a step back, that's kind of captured a lot of the interest and attention, but to take a step back and look at things a little bit more broadly, we're actually looking here kind of the number of people in the working age population who have a health condition. This chart shows how that's changed over the last 10 years. And in particular, the red line shows anyone with a long-term health condition, and there's around 37%, 36% of the working age population in that group. But the blue line here shows the proportion of people who have a work-limiting health condition. That's a condition that affects the type or amount of work they can do. And that has increased gradually over the last 10 years or so. It started before the pandemic, and is now around 19% of 16 to 64-year-olds in that group have a work-limiting health condition. That equates to around 8 million people, rather. So a really significant issue. And there's been increases across age groups, and I think what stands out when we look at the data is the really sharp increase in younger people, in particular with mental health conditions. But across age groups, MSK really stands out as well. So a range of factors behind us, and we're keen to understand that better. And that increase in working age people with work-limiting conditions has a range of impacts, and has impacts people out of the labour market, which we've just seen. So the purple line here, it's a little bit difficult to distinguish. The purple line starting at the top shows the number of people with a work-limiting condition who are labour market inactive. So that's increased quite considerably. We can see the really quite sharp rise over the last 5 years, and that's feeding into that increase in people who are economically inactive due to long-term sickness. I would say the kind of striking thing there on the purple line, it's even higher than that 2.6 million figure I mentioned earlier. It's about 3.9 million. So the people who are inactive, who don't say that their main reason is sickness, but do have a work-limiting health condition. But what I particularly draw attention to here is the red line. That shows the number of people with a work-limiting condition who are in employment, and it's really increased really significantly over that period. There's now around 3.7 million people of working age in employment with a work-limiting condition, close to the number of people who are out of the labour market. And that creates challenges in itself. It's partly a good news story. More people are in work with health conditions, but it also creates challenges for people in work, like related to sickness absence, which has increased at a really high rate recently, related to productivity for people in work, and also a risk of greater flows out of work into inactivity. So a really important issue. And despite that improvement, that increase in people in work with health conditions, there's still a really significant gap, a health-related employment gap between people with and without work-limiting conditions. Overall, the difference is around 36 percentage points. So the top line, the top bar here, shows people without a work-limiting health condition. Around 83% of 16 to 64-year-olds in that group are in employment. But the overall employment rate for people with a work-limiting health condition is less than half. So really significant in itself. And this chart breaks it down by different condition groups, by the kind of main condition that people report. And again, we can see quite a lot of variation within this. In particular, again, we draw attention to mental health conditions at the bottom there. Only 40% of 16 to 64-year-olds who say the main health condition they have is a mental health condition were in employment recently. So a really significant issue. And furthermore, the last point on the data here, we don't think this problem is going away. So this slide shows some projections from colleagues in the Health Foundation's REAL Centre. And it shows the change in people living with major illness over time. What we can see in particular, the red bar, the bottom bit of the bar here, reflects the number of people of working age living with major illness. And that's going to set to increase from 3 million in 2019 to 3.5 million in 2030. So an increase of around 500,000 or 17%. So a really significant challenge in the working age which isn't going away. And that adds to the kind of wider challenge of funding and caring for an aging population who are living with more health conditions. So really significant pressures there and fiscal pressures as well. So that's a wrap up of the data and some of our understanding of the challenge and issues that we're facing. So we're bringing together the Commission, as Jennifer mentioned. We're bringing together a really wide range of commissioners, and we'll hear from a number of them today, including Sasha Romanovich, who's chairing our commission, and Gavin and Beth as well, who are involved as well. But we're keen to bring together employers, workers, health and policy experts, and supported by the team in the Health Foundation, an expert advisory group we've brought together as well, but also research partners, and I'll mention, I think some of them are here, the Learning and Work Institute, the Institute for Employment Studies, and the Royal Society of Public Health as well, who'll be delivering a range of research papers throughout the year to really help us understand the problem in a little bit more detail. And a public involvement programme as well, led by Clearview Research, and we're really keen to put a spotlight on lived experience and learn from people's experience in different communities and different situations across the UK. So what will the Commission do? I think we've already mentioned it. We want to produce and share new research on work and health, and we'll have a series of papers coming out this year with a particular focus on inequalities, both between people and places as well, and it's a really significant part of the Commission. And we're keen, really keen, to build that consensus about what the nature of the challenge is and what we can do about it. And the action needed in particular by, as we've seen on the slide, by government, by employers and by individuals as well to address them. And as we mentioned, we're really keen to reach towards final recommendations and recommendations for what we can do about it. And we'll be reporting in spring 2025, but we're obviously conscious of that a general election might take place this year and we'll need to respond to that as well. So that's a summary, I think, of what we're looking to do. I think the key part here is that we can't do this alone. We can't build a consensus alone. We're really grateful that everyone's here today. We really want to hear with you and engage with you. Thank you for those that have already spoken to as well. And do share your thoughts as well through the day today. Do share, stay for the drinks at the end as well. But yeah, I think that's me. You can sign up here and find out more information. But yeah, thanks again for everyone to be here.
Chris, just stay for 1 second while people sort of this slide. Just one question, if I might. I mean, clearly this has been an interesting thing for government. And do we know what the working hypothesis is at the moment, for example, in the Treasury, about where we are, what the reasons are for this incredible pattern that you've just described?
Yeah, I think it's a really good question. I think what's encouraging, I think, is there has been a lot of attention on this. I think the Treasury has been interested and is looking at this. I think there is a recognition that the health of the population matters and is having economic implications. So I do think there's a growing understanding within government and within Treasury and appetite for joint working across government as well. And I think we've seen some encouraging announcements in recent fiscal events. Some of that is smaller scale, but I think there's a lot to build on and a recognition that it's an issue that we need to be thinking about. So I think it is very timely, and I think that is encouraging, but there's also a need to think bigger about it, to recognize the nature of the challenge, the long-standing challenge that we're facing. And I don't think when we think about something like working age benefits and the challenges that's posing, I don't think it's something that we've ever been particularly good at grappling with and getting to grips with. So I think there's a need to think about it afresh as well.
Yeah, thank you. So lots of room for us to make a difference here. Thank you so much, Chris. Wonderful. So now I'm going to ask our panel to come up to the podium here. And while they're doing so, I will attempt to introduce them here. Thank you. There we are. So, as Stephen said, we're lucky to have 3 of our commissioners here. Next to me here is Sasha Romanovic, who is the Commission Chair. And Sasha is the CEO of something called Fair for All Finance, which she'll describe, I guess, in her comments if she would like to. But she's also a member of the government's Levelling Up Advisory Council, and she has many other roles and has had many other roles, which I shall gloss over. But the full biography is can be accessed through the Slido and through our website. Next to her is Beth Coombe-Holland, who is a social entrepreneur and founder of Patchwork Hub, a disabled-led social enterprise providing an accessible jobs board, bespoke recruitment services and training consultancy. And Beth is a passionate advocate for disability inclusion and neurodiversity. And next to Beth is Gavin Kelly. Gavin is the chair of the Resolution Foundation and the CEO of the Resolution Trust. And Gavin is also the chair of the Living Wage Commission. And again, he's had many other relevant roles, not least in Number 10 and in policy at the centre of government. And also next to Gavin is Dr. Claire Fernandez, who is an occupational health physician and the Chief Medical Officer for the BBC, looking after the health of 22,000 employees worldwide, no less. She's the joint founder and director of Occupational Health Academy, a learning academy for aspiring occupational medicine doctors. So well done. I'm very glad to have you here in your busy life, Claire. So I'm going to ask each of the panelists here to make some introductory remarks in the order in which I introduce them, and maybe in response to what you've just heard from Chris. Thank you.
Brilliant.
Fashion.
Thank you, Jennifer. Oh, I always feel like I should be doing a Madonna-style sing, but you'll be really glad to know that I'm not, because that would not be good for anybody's health if I started singing. So I thought maybe I'd start in terms of why I am committing time to actually chair this commission. So I've sort of got probably a sort of an odd background, and I'm not a clinician, so I come from sort of different perspectives. So in terms of my career, I've led a large accounting firm and had responsibility in the UK for 5,000 people, but across the world we had over 40,000 people across 140 countries. In my current role, I'm now CEO of an organisation that's focused on financial inclusion and really paying attention to the fact that here we are in 2024 in the UK and we have over 17 million people in financially vulnerable circumstances. And what can you do about it? And the crossovers in terms of people's physical and mental health and financial exclusion is something that I can elaborate on at length, but I shan't today because otherwise Beth won't get a chance to speak. And as Jennifer said, I'm also on the Levelling Up Advisory Council with a specific focus in terms of social infrastructure and a real interest in terms of social capital and some of the impacts of low-paid work and exhausting work on people's capacity to then engage in communities and how all of these different levers work together. So those give a few backgrounds. I also, as you may or may not know from my bio, I'm also a non-executive on the board of Leapfrog Investments, which is a big impact investing firm and does a lot of work in Asia and Africa, and is doing some really interesting stuff looking at early stage health interventions, which started from them looking at financial inclusion and places where there isn't any kind of safety net, and then starting to look at what you could do to intervene upstream, if you like, to equip people to have thriving lives. So there's some really interesting stuff from there that I hope to bring into the Commission. But I thought, just for intro comments, I thought maybe I'd sort of draw in terms of a couple of different perspectives that start to sort of think about the questions that we're posing ourselves. And today is very much around inviting as many people as possible to bring their insights, bring their expertise, bring their questions to the table, so that the work of the Commission really is as rich as it possibly can be to drive forward practical recommendations that can make a difference to people right now, as well as some of the longer term things that we think will need to change. So, as an employer, I think there are a number of reasons why employers do sit up and take notice. One is a simple risk perspective. We know, I know from my world in financial services that if people are exhausted and under pressure, they make bad decisions. I'm always interested in the question of what happens when good people do bad things. Generally I come from the abundance view that most people are good and want to do good stuff, and therefore if they're in a situation where they're making poor calls, poor judgments, what is happening in the environment around them that is making that happen? What's great is we've got employers who are looking at that. Last year I was over in Dublin with the Energy Networks Association, and it was really interesting looking at the depth to which they were sometimes thinking about this. So, right, someone in here is probably going to be an expert on this, but I did not know this before, that they were investigating the impact of tidal patterns and shift work on workers going out into oil rigs, and then the instance of accidents and other issues on oil rigs as a consequence of some of those choices that employers could be putting in. And so it's great that you've got some people who are thinking about it to that degree of depth. And I think also really thinking about the questions of how you can ensure the workplace is enabling for people to get into and be part of, and also just us exploring, well, how has work changed? How has the environment changed, which might be putting more or different pressures on people? And Jennifer is sitting too far away from me to kick me, so I've got two other points I'm going to make before you kick me. But exploring some of those things from the fact that 2007, if we were sitting here, the iPhone hadn't even been invented. What are the consequences of being always on? What are the consequences of asking people to manage, ever decreasing budgets and still deliver more and more? What impact does that have on people? I'm a volunteer in a community fitness project. I see that a lot. My second bit is just going on to that individual economic prosperity, and I think it's just to say that 17 million people in financially vulnerable circumstances. What are the drivers of people going from just managing to struggling? Two of the big ones are life events, which can be a job loss or a bereavement, and physical and mental health issues. People in those situations massively more likely to be in financially vulnerable circumstances, and there's a well-trodden path to actually show the link between being in a financially straitened position and your physical and mental health. Give just two examples. I think it's 2.7 million people are living without a fridge, a washing machine, or a cooker. Think about that in terms of the impact on your ability to eat well, etc., etc. There are 239,000 children from a recent Barnardo's report who are sharing a bed with a parent or a sibling. And think about the impact of that on people's ability to get decent night's sleep, and then the prevalence of musculoskeletal issues. We see people wanting beds as one of the real issues that we see. And then the final bit I'll touch on just very briefly is the social capital side. One of the things that we notice in terms of levelling up is that social capital is high, where people have got time to give their energy and their ideas and their resources into their community to actually affect changes that are actually positive for society. If people are in work where they are exhausted and they're having to maybe do multiple jobs to actually put food on the table, it is not surprising that you have to be pretty extraordinary to then to be doing that kind of work in community as well. And so places can be doubly damned, that they miss out not only in terms of the work, but they miss out on all of that insight and ingenuity going into their society to make a difference. So those are some of the things that I'd like us to think about. She's like, yep, not. But I think, for us to think about what takes us from being alive, surviving, to being alive, to thriving, that's what we've got to work on together, and I'd love people's ideas, and sorry I went on so long.
No, fantastic. As you're the chair of the commission, Sasha, I've given you that extra leeway. Thank you so much. But we will move smartly on to Beth here for your comments. Thank you.
Great. Really lovely to be here today, and it's such an important topic that we're talking about. So I guess just to start with, just give a bit of background as to my story with starting Patchwork Hub. So I started Patchwork Hub because of my own lived experience of disability. I live with a whole host of chronic illnesses, and despite working really hard to try and build my career and skill set, and I graduated from Oxford, Harvard, and just gave everything 110%, I just couldn't sustainably work a conventional 9-to-5 job in an office. And I quickly realized through my disability advocacy work just how many millions were excluded from employment because of barriers in the way things are conventionally done. So very much looking forward to the commission, and I just think it's never been more timely and needed. So through my work with Patchwork Hub, I've seen so many people either unemployed or working in a way really detrimental to their health, just because of a lack of awareness and support around the challenges in conventional practices. And I think as we're beginning to talk about, it's something where these are supremely talented people with so much to offer that we're currently missing out on or sidelining just because of the way we do things. And as Christopher mentioned, we've got a disability employment gap, which remains persistent at around 30%. But where people are in jobs with disabilities, evidence also suggests a much slower promotion rate, lower average salaries for those people. So just to quickly lay out what I think these challenges look like in practice. So I think first, at the most basic level, I think the basic requirements around physical and digital accessibility still aren't quite there yet. Even in the UK, where we think things are ahead of the game, there's still quite a way that we need to go with this. And workplace cultures as well, there's so much rigidity around the way we do things, and inflexibility around ways of working, or sometimes those informal hoops that people have to jump through to get ahead. And thirdly, in terms of attitudinal barriers that disabled people and those with health conditions face. So this could be assumptions around the skills people have, the things they can achieve, or the general lives that they're leading. And I think that we can have the most accessible processes and procedures in organisations in place, but if those ignorant assumptions remain intact, disabled people are just never going to be able to thrive in the workplace. And fourthly, I think disability inclusion is routinely deprioritised in companies' diversity and inclusion agendas. One recent study found that despite 90% of companies claiming to prioritise diversity and inclusion, just 4% consider disability in those initiatives. For too many companies, disability inclusion remains the afterthought. And I think a greater focus on disability inclusion in diversity and inclusion agendas could have so many positive implications for healthier working lives, not just affecting disabled people, but as we're mentioning, so many other people that are affected by this. And finally, just to pivot quickly on to a different point that I think sometimes gets missed out when we talk about employment. As a disabled founder of a business and someone who advocates for disabled entrepreneurship, I think it's really important we don't just focus on employees of big companies. There can be different challenges across small businesses, but also self-employment, from freelancers through to entrepreneurs. Given the barriers that do exist in conventional workplaces, I think it's not surprising the stat that disabled people are twice as likely than their non-disabled peers to start their own businesses or be self-employed. But that also has challenges too around access to funding, inaccessible work cultures, and one that I've encountered a bit too often, people's attitudes to me as a disabled founder. For example, far too often people have assumed that because I'm disabled, my business must necessarily be some charity-style, small-scale lifestyle business. And in the early days, I was definitely met with a often well-intended but somewhat patronizing, "Oh, good for you keeping yourself occupied despite everything," rather than just treating me as a business leader. So ultimately, it's so clear to me that in our conventional approach to work, it raises barriers and it keeps out and derails so many talented people, and it's undoubtedly contributing to the health challenges that we're looking at today. So I'll pass over now, but just to say, I think this work's so sorely needed, and I'm really excited to see how it unfolds.
Thanks so much, Beth. Over to Gavin.
Yeah.
Thank you.
Thank you, Jennifer. So I'm going to start with a confession, which is, it was in December, I was involved in a different commission for 2 years, and at the end of it, I said, if there's one thing that I can say with conviction, is that I'm never going to take part in another bloody commission again. They're overrated, there are over too many of them.
Was it this one?
It was that one, God almighty, I'm having flashbacks.
Stagnation Nation is a must-read for anyone who's bothered about Britain.
I didn't ask Jennifer to say
Sorry,
that. Yeah.
it's very good.
Anyway, so there I was saying that, and I said it in front of, I made the mistake of saying it in front of the whole organisation as well, and then lo and behold, not a month later, I'm sort of murmuring that I might be taking part in another commission.
Thank you.
So why am I doing that, apart from being incredibly weak-willed? So in my mind, a process like this is, people are sinking their time and their organisational capital and so on into this process, and the world is full of people asking questions about policy. Do we need to do this? I think we do, which is why I'm here, because it's not a small issue; it's a bloody big issue.
Yeah.
Chris's chart showed that. It's a massive issue. We need new insight. There's lots of, I'll touch on this, there's lots of big questions. I follow some of these debates. We don't know the answers to some of the really important drivers of what's going on in this country in terms of ill health and employment. It's very likely that this is not going to solve itself. The trend is not our friend. It is going in the wrong way. If we leave it alone, it will get worse. And the solution is very likely to be complex. It's going to span employers. It's going to bring in the social security system, a range of public services. Governments aren't good at doing that thing and doing that sort of thinking themselves. They need external stimulus, and that's what this is in part. So I think it passes the tests of kind of, in principle, this is a good idea. Now, I just want to make 5 very quick remarks. I'm not going to linger, and if I do, then you can just about hit me from where you are sitting, Jennifer. The first is ill health. We are sicker as a nation than we were 3 years ago and indeed 10 years ago. Part of that is because we're poorer and we've undermined our public services for a decade and more. And the countries that do that get sicker, generally speaking, so we shouldn't be too surprised. But what I've just said, though true, isn't a sophisticated enough analysis of what's really going on. And there are lots of things which we need to go underneath, like how the relationship between kind of population-wide ill health and just how hard it is or not for different groups to stay in work when they're experiencing ill health, and how that varies across different groups in society. I don't think we've got a full understanding of that at all, to be honest. How easy is it to work in Britain compared to other countries if you've got a long-term condition? I don't think we really have a good grip on that, how we perform comparatively and so on. And crucially, is it to return to work if you've left work? Again, another issue. I could go on. There's lots of things we don't know that we need to know, and I don't think the government fully knows either, and I think they'd probably admit that. So that's the first thing. The second thing is, economically, this is a really big deal, okay? It matters to the future prosperity of this country in a way that people didn't think of in terms of health a while ago. Health was kind of slightly at the edges of the mainstream macroeconomic debates 5 years ago. If you do surveys of top economists today, health is right up there. It's one of the issues they're most worried about. 5 years ago, there was a trade. Today, they're saying health. It really matters to overall employment, to household incomes, and so on. So it matters economically. It matters fiscally. We're spending £50 billion plus a year on working age people in terms of health-related benefits at the moment. That's due to go up to 70-odd billion by 2028. That's a 50% real terms increase in 6 years. That is a lot of money. And none of that takes account of forgone taxes. So this is a huge amount of money fiscally. Sometimes people say that in a loaded way, like, and it all needs to be, that's not how I'm saying it. I'm just saying any government of any complexion looking at that quantum of cash is going to ask lots of questions. Yeah. And that will happen particularly if there's a new government or if the current government's re-elected, that's going to happen. It's a lot of money. The fourth thing I would say, and this is one of the reasons why I'm here really, is this issue intersects with a couple, I mean, this is a broad-based issue. We've seen the trends that Chris showed earlier across all age groups, we see it, but it does play out particularly amongst certain demographics. And for me, I worry really a lot in lots of different ways in terms of what I do in my job. I worry about two groups in particular. One is the kind of pre-retired, low-income people who are no longer working, who in different world possibly could be working, who are currently too sick and too, you know, have basically been on the wrong side of life in lots of ways, but are quite a long way off the retirement age. Yeah. And that's a large group of people, and a large share of them are caring, and a large share of them are in poverty, and their well-being and measures of kind of life satisfaction are abysmal. And public policy has failed that demographic for far too long, and not all, but part of the solution to that comes through looking at the sorts of issues that we're going to be looking at. So that's one group. And at the other end of the age spectrum, you know, we have got this incredible issue of young people who are not active in the labour market because of ill health. And it has exploded in the last 10 years, and we have not talked about it. Yeah. And it's overwhelmingly concentrated amongst people who have got low levels or no levels of qualifications. 80% of the rise has come from people whose highest level of attainment is GCSE. And that, in any country who cares about its future, you would be talking about that. That is a car crash in the making for the next 50 years, because that has huge impacts on those people's earnings, their well-being, and so on. And we're blithely just watching that trend explode. So that is part of my fourth issue about the groups I really, really worry about. And the final thing I would say is you can't undertake a big project about work and health without talking about rubbish jobs, bad jobs in this country, and we have a lot of them. And I could talk for hours about this, and I'm not going to do it, so don't worry. But we have a real issue about low-quality employment and its interaction with health, partly just driving bad health, but partly also just making it impossible to have a health condition and stay in that sort of employment. There's lots of studies now showing that, you know, well, actually, there's one particularly powerful study which follows people who've been unemployed into different types of work, and if you're in what the researchers measures to be a low-quality job, and there's various ways we can define that, actually people's mental health actually deteriorated from being unemployed, and being unemployed is incredibly bad, by and large, for your mental health. The similar groups of people, when you control for it, who moved into better quality work, saw a transformation, not surprisingly. It really, really matters. So the burden of that point is, if we want to talk about health, we have to talk about what we're going to do to deal with bad employment in this country in a way that we haven't talked about in decades. Yeah. And I'm going to leave it there.
Thank you very much. I'm going to come back to you each with questions, but thank you for that. Gavin? Claire, very interested in your perspective, especially at the Beeb.
Hi, everybody. My name's Claire Fernandez. My apologies, I wrote some notes, but being a typical doctor, I can't really read them. So I'm also relying on my phone as well, so apologies for that. So, as has been said, I work for the BBC, so I'm the BBC's doctor, if you like, but I work in a non-clinical capacity on policy, governance, processes, and general advice. I'm also a practicing consultant in occupational medicine. We talked about intersections, so occupational medicine is where health professionals look at the intersection between work and health. So there's not that much to say that hasn't been said already. That's the beauty of going last. But I think that this work that's being done has the potential to be so powerful. In my role, it's sometimes challenging in both roles, as a practicing clinician working with employers, and then in my non-clinical role, it can be a challenge to firstly have employers understand the importance and engage with the importance of health in the workplace, but also for employees to engage. And I think that some of the ways that we can get both groups of people to engage is to look at the evidence that's been there already. As Christopher alluded to, we're building upon evidence that is already there. So we know that for individuals, the importance of being at work is more than just financial, even though we all do go to work to get that dollar. It's more than that. It's about being empowered. It's about having that social sense of well-being and self-esteem that comes from being part of that community. And for employers, it's a no-brainer as well. Thinking about one health condition, fibromyalgia, the evidence shows that for each employee with fibromyalgia, which is a chronic physical health condition but can also have mental health impacts too, it costs an employer £8,000 a year in productivity and absenteeism costs for one employee. And that's not even one of the ones that's on trend and being talked about at the moment. And we know for mental health conditions, which there's a lot of talk about in this present time, as Chris mentioned, because so many young people have significant mental health problems for a variety of reasons. It's at least £1,000 per employee per year. And that's just in the workplace. That doesn't take into account the costs on the taxpayer, the costs on the NHS, and the economy as a whole. So, sorry, I have to go back to my phone now, which tells me what to do, because I can't read my writing. So just thinking about engaging from that point of view for those benefits is so important. And as been touched upon already, there's so many health-related challenges, regardless of what industry you're in, regardless of what country you're in. So I have employees from those going out to do those natural history programs that we all love, to the cleaners that work in our offices in Afghanistan and Nepal. And the health challenges and the health profiles there, as well as the general infrastructure, is so different. And so many have been touched upon already. But when you think about, for example, women that are menopausal, 75% of women that are of menopausal age, which is approximately 51 years of age on average, they're in the workplace with sort of the pension crisis and the increase in working age and the age that people have to work to for various reasons. We know that more and more people of increased age have not one condition, but more than one condition perhaps, and the impact isn't linear, it's cumulative. And when you think about the aging population increasing 12% since 2020, that's huge. And extrapolating it further, as Chris said, becomes a real concern. So, finally, when we're thinking about solutions, I think it's really important not to reinvent the wheel, but as Chris said at the beginning, to build upon the work that's been done already. There's so many things that are there already. There's so many people that are saying similar things in different ways. So the NICE guidelines, the National Institutes for Clinical Excellence, or a bit of a tongue twister, the ISO 45000 series for health and work, the WHO, the World Health Organization, and even things like the Faculty of Occupational Medicine and the Society of Occupational Medicine. I say that because there's somebody in the room there and I want brownie points. But also, when we think about the different resources that there also, it goes beyond guidance. Think about Remploy. Think about the Access to Work scheme. Think about these things that exist already and how we build upon and amalgamate them into the solutions that are proposed. That's really, really important also, I think. But that's it from me. Thank you.
Thank you, Claire. Thank you, everyone. Well, we've got masses of questions, so I really actually am going to turn to those first. I want to ask an opening question, and please pitch in if you have an answer. If you don't want to respond, that's fine. And that is, how do we compare to other European countries? Is it just us? Was the most popular question, I think, of the audience today. And if we are unusual, why on earth could that be? Who wants to have a go at that?
Me.
Gavin.
The panel just voted, unfortunately. Well, I should have said at the start, I'm not a health expert. I'm going to say that kind of probably every time you ask me a question. But I can talk about, so post-pandemic, we are very unusual. Another caveat is our employment statistics in this country are, the people who produce them are having a bit of a crisis because we've kind of learned that they're not very believable. So that caveat hangs over this. But to the best of our knowledge, the hit that our employment rate took post-pandemic made us a real outlier amongst similar economies. So we were different to most of them. The hit to our well-being of the population, and there's different measures of well-being, but they're pretty well established, makes us an outlier. I mean, everyone took a hit, obviously, because of what happened, but I'm talking about the recovery and the depth of the hit into employment. So something unusual did happen here. And I think we, like a global pandemic at the end of a long period of deep restraint for public services, on top of an unusually threadbare system of income support and sick pay and so on. I mean, part of the infrastructure you would want to have there is quite weak in this country relative to some of our peers. Not relative to all countries, but relative to particularly some of our Northern European peers. So yeah, we are a bit unusual, but I also don't think we have good enough answers. I don't think we have a good answer about how we compare in terms of how it is to work with different types of conditions, like for like, here compared to France, Germany, Holland, so on. And I'd really be interested in that and how that's changed over time. So I'd be interested, but if anyone else wants to answer.
You want to have a go? Yep.
I think I agree with Gavin. I think there's an awful lot that we don't know. I'd say that just in terms of sort of more generally, in terms of working environment and working hours, that there are different approaches in different countries. Certainly when I was working globally with employers around the world, it was just quite interesting seeing some very different attitudes and I think extremes where probably they're stereotypes, but as Chimamanda Adichie said, sometimes stereotypes are there because they tell part of the story quite well. That, in terms of my North American colleagues, there were an awful lot of things in terms of just expectations in terms of work, limitations in terms of holiday and stuff, that they had a lot more prevalence of certain health issues than were experienced in, for example, our offices in Greece and stuff like that. So there were some things that was just quite interesting there. The other thing I found fascinating in all of our US offices were the snacks that were available for people in the workplace, which was uniformly an awful lot of sugar. And just as sorry, this is apropos of nothing, but I just think it's quite funny, is that whenever we had secondees go to our American offices, on average, it took them 2 months to put on a stone in weight, which was just fascinating, just in terms of that difference in terms of diet and what it made to people. So that is not scientifically proven, but it was just fascinating seeing what happened to people.
I mean, sorry, I don't... No. I mean, just looking at the health stats, I mean, on our website as well, the UK and the US are outliers in one respect, and that is that the slowdown in the increase of life expectancy has been more marked in the US and the UK. And in particular, in the UK and in the US, but that there is a higher mortality or injury in the 25 to 44-year-old age group. We don't quite know why that is, but that's the kind of backstop of the health story, I think. But while I'm just asking Claire, given your reach into different countries, are you seeing the same sort of health problems that you see here in other countries, or is it very particularly different in this, particularly maybe comparing us with other European countries?
So I was very deep in thought there when thinking about the different countries that the BBC operates in. And slightly aside to your question, I think that health is very multifactorial, and that's why sometimes it can be so challenging, because you can have two people with the same or similar health conditions and similar functional abilities that are differently negatively impacted by it, so differently disabled, if you like. And sometimes health, because it's so central to being part of who we are, which sometimes we don't appreciate until we have bad health, it interacts with so many different things, that there's so many cultural nuances and different factors that are outside of us that impact upon it. So, for example, as has been talked about already, this idea of having a terrible job, I'm paraphrasing, but, having poor work or poor social support, be it in work or outside of work, or poor health infrastructures, or poor access or poor health literacy. So it's quite complex when you start looking at it like that, which is why it's so challenging. I can't necessarily comment for within Europe, but certainly within some of our offices, the health profiles have always been different because of the different countries we operate in and the different infrastructure, but also because the different types of staff that we have. So we know that there's health inequality between, for example, people that are British that are from a Black and Asian ethnic minority background, or the LGBTQ plus background, but also if there's a difference in socioeconomic status, and that holds true around the world. So when you start looking at it like that, it becomes a difficult question to answer.
Yeah, thank you. So there's a few questions about the working of the Commission, in particular making sure how is lived experience of working people, and I presume also economically inactive people, going to be woven in. I think that would be useful, or as well as our diverse range of people. And there's another question there about how will we engage SMEs, small and medium-sized enterprises, in this debate as well. So perhaps I can turn to maybe Sasha for the first answer, and maybe Beth for some of the public involvement.
So there are a number of different layers, and some of those are still a work in progress, so there are opportunities. So in terms of the Commission membership itself, we haven't yet secured, we're in discussions with a number of people, representatives of basically small employers who can actually bring that perspective to the table. So we're in discussion with a number, but equally if you think there is someone super brilliant that we might not have spoken to yet, then that would still be open. It's great looking at Christopher, who is leading on the secretariat side, and I can just watch his body language as to when he's like, no, don't go there, and when is he okay. The other area that we are looking at is just in terms of Commission membership itself, the extent to which we have someone around the table as a commissioner who has got that direct experience of low-paid, struggling work without putting the labour of them representing the challenges that sort of come with that. So that is something that we're looking at quite closely, and Peter Babadou, who's one of our commissioners, is helping us just actually think that through. The other aspect is the work in terms of lived experience engagement, which Clearview are working with us on. So we've got it at different levels, and I know that Ros, who's looking at the expert work, I think we're also hoping to have quite a lot of people giving evidence so that we can test out the evidence from lots of different perspectives as to, well, does this stack up? Does this make sense? And then similarly, when we get things to a policy level and recommendations, to be able to apply that, that really simple test. I always I always do it. I've moved away from the traditional man on the Clapham omnibus to someone walking down the street in Exmouth, where I live in Devon. You know, I run with lots of people who are in very different situations, and ultimately you want stuff that's actually going to make sense to people and say, yeah, okay, I get that, to people who are actually living the daily realities of, you know, all the different challenges we're talking about. But I don't know, Beth or anyone.
Beth, yeah, thanks.
You know, just to add, I think it's really important to make sure that SMEs' voices are coming through, because one of the things that I've definitely found through Patchwork Hub and working with organisations of different sizes is actually sometimes small businesses that have the most positive employment outcomes for employing people with disabilities and chronic illnesses. I guess it's partly just through the nature of the fact that there's a bit more, a bit less bureaucracy and red tape to go through, but also in terms of being able to provide that flexibility, being able to provide employment contracts that maybe they're fixed hours, or there's just more flexibility around freelancing and that side of things. So it's really important that that voice is obviously coming through and is a priority area, because I think that there's a lot that we would learn from that sector that we could bring out. Of course, there's certain things that large corporations aren't able to do, but there's a lot that we can learn from that approach that small businesses are taking. So I'm very hopeful when I look at the landscape of small businesses that are out there and the great work that they're doing, that in the solution-based approach that's driving this commission, that will come through, because I think there's so much best practice that we can learn from that.
Thank you. So I know there's a question in the audience. I'm just going to go a couple more of the Slido ones. One is, to what extent will the Commission focus on economic inactivity of the working age, or those in work who have health issues? So how far are you focusing on people who are outside the workforce, or people who are in who may be at risk of slipping out?
I'll start, but I can build. I think it's really important that we're paying attention to both, for every reason that I sort of spoke about at the beginning, in terms of sort of wider society, in terms of employers, in terms of actually consequences for family and stuff. Fundamentally, if you have a work where people in work are struggling and exhausted just to actually keep going, that has consequences from everything from, you know, business and productivity, which is, despite my background, is probably not my natural first go-to, but I will name it as a first go-to, right through into people's personal lives and society. And it's very easy to see those things spiral. So I think looking, you know, for me, I think I've always come from the perspective of looking and understanding around what does a great, thriving work look like? How is that enabling to give everybody the opportunity for the benefits of that? That's got to be where we look. And so, yeah, it's easy to fall into sort of populist narratives. I think it's really important we're not doing that. We're looking at what creates great, thriving work that the maximum number of people can participate in, because that seems like the really right territory. But Gavin, you might have something to add on that.
I agree with all of that. The extra thing I'd add is just, I mean, if you do just one or other, it's not serious. We haven't met yet, but that's what I'll be saying when we meet. So you have to do both. But I think it's really important also just to kind of focus on returning to work and the transitions, because the binary point is a really important one. It's not just like there's two camps of people, right? Yeah. Most of us at some point will have some period of our lives where, for one reason or another, it's to do with our health and well-being. We have time, and obviously some people that's going to be much longer, and other people not so much. But it's like, this is a majoritarian sort of issue, and we need to think about how we ease that transition for different types of people in their working lives. And I think the more we can break out of the inactive in a box and the kind of productive working population in another box, the better, basically.
Yeah, thank you. While you've got the mic, stay with it, because there's another question which is along the lines of, I mean, clearly we've had the pandemic as an insult to the nation, to the health insult, but there have been other big bounded insults, haven't there? Including, you could say, the financial crash, well, obviously the cost of living since.
This is going to be a big question.
The big question. Yeah, yeah. So the cost of living since, and then you've got the deindustrialisation, particularly in the north of England. That happened over a longer period. Maybe the miners' strikes, another scar. So to what extent are we going to be, I suspect the answer is both. To what extent are we looking really at the pandemic, because that's what's caused attention right now, or to what extent are we going to go back and look at this scarring?
Yeah. So I think it does have to be both, and that sort of sounds glib, but it has to be both because the pandemic was massive, right? I mean, what has happened, we've got 450,000 or so people who are inactive because of ill health post-pandemic that weren't there, that weren't in that position pre-pandemic. That's a big chunk, right, of your workforce right there. So you absolutely have to understand what's going on there. But if you look at, but there's a slight trap that people in my world fall into of just like pre-pandemic, post-pandemic. The kind of secular trend in like mental health amongst young people, that didn't start with the pandemic. No. When the pandemic gave it an extra, you know, sort of a twist and dialed it up significantly. But that started significant, and it wasn't just a couple of years before, that was significant.
2011.
2011, 2010. So like, and there's other when it comes to physical health, there's other trends that started at different points. So different things are going on here.
Yes.
And if you care about the kind of health and employment of the nation, you have to look at those big drivers. We can't look at everything, no doubt, but I think we have to look at some of the big drivers, and they started at different points in time.
Right, thank you. Anybody else? Shall I then turn to Paul, not least because Paul's on our board, so I better ask him to take up his offer to ask us a question. Lovely, Paul, there you are. Thank you.
Thank you, Jennifer, and thanks to the panel. It's really exciting work. I know you've got a lot on your plate, panellists, commissioners, so I'm interested whether you might look at the how of policy as well as the what of policy. And I think what I mean by that, as a local government person really, is I think some of the community engagement and some of the join up between public services that you need, I don't think that stuff can happen really at the level of the nation. So I'm interested whether you might think about some of the hows and the connection of this work with devolution and places. Really interested if you see that as part of your brief. Thank you.
As Gavin said, we haven't had the first commission meeting yet. We've got that on Thursday, but I am very keen to look at the how, and I suppose I'm looking at it from, I'm essentially an optimist, right? I always look for possibilities, and I know that amidst all the doom and gloom of the stats, there are some brilliant things happening, which are collaborations between people coming from different places who are working together really well to actually do things that are shifting and changing the dial. So when you talk about the how, I'm often interested in not just the theoretical how, but actually what is the practical how that is happening out there right now, and shine a light on that so that we can learn and actually accelerate that. Because oftentimes what I see is there are brilliant people doing amazing things who actually feel quite lonely and isolated and carrying all the labour of that. And actually sometimes just being able to shine a light and say, so what is happening there? What could work? How could you make more of that happen is really important. And it's interesting in terms of the levelling up side of things. One of the things on the social infrastructure side, there was originally quite a lot of focus in the paper on the physical infrastructure, and I'm trying to really sort of shift that to say actually it's the social, as in interactions with people, the social, how people actually work together to actually get things done, and what are the different levers for central, local, businesses, etc., in that system that enables stuff to happen that I'm really interested to probe. So we're hopefully now, having gone through a year of procurement in terms of central government, got to the stage of actually commissioning some deep inquiries in place to start to test that sort of system engagement and how people come together to get stuff done. And I'm really interested to hear from anyone working in that space. I spent Friday with in a research sandpit with finding all sorts of amazing people researching things that I hadn't even really realised were being researched. So I'm open to discovery and just sort of seeing if there is stuff you see happening that you think, this is brilliant, this could be a how that could be shone a spotlight on, please make sure that we know about them. I discover every day in my work I'm finding stuff I didn't know about, which is marvellous.
Thank you. So there's a question about unions. Are they important in this agenda? So I'll turn to Claire, and then I don't know, Beth, whether you have had any interactions with unions in all of your work, and if they add value, and how should they? Thank you.
Yes, unions are incredibly important, in my opinion, for many reasons. So they're a body of motivated individuals that want the best for their colleagues. So I think they're a powerful stakeholder. They're also a body of people with lived experience of all sorts, which is so important to understand. When you talked about the whats and the whys and the hows, actually understanding why, Simon Sinek's why, understanding why they are so motivated on a particular topic. So for me, it might be noise or mental health. Understanding why is really important to be able to tap into that narrative and give an answer that's relevant and appropriate and timely, because they are such a powerful body that represents everybody. We have at least 4 unions within the BBC that I can think of, and they are the voice of the people, and being accountable to them is my everyday job, and is every employer's everyday job, I think, because it is very important to have health and well-being accountability within businesses. So that was a very long way of saying yes.
Thank you. Beth, I didn't know whether you had anything to say, whether they've been helpful in your work? Or?
Yeah, so in terms of the sectors that we've worked with, I've not done much direct work with them, but I can say that in terms of their power that they bring to, as Claire said, in terms of giving that voice to lived experience, because I think so often the burden is often on the individual to advocate for themselves, which can be fine for some people, but it also relies on the confidence and trust of that individual to be able to do that. And I think too often without structures in place, when it is just solely the individual, that's where we can have issues and unnecessary barriers. I think there was a recent Bupa study that found that 2/5 of disabled people with less visible disabilities don't disclose with their employer, and that's a minimum statistic. For obvious reasons, it's likely a lot higher than that. So it's definitely an area where it's so important to make sure that those lived experience in any system and structure that are engaging with, that's coming through. But I think that too often there aren't those sorts of systems and structures in place to protect people who are facing working ill health. So I think it's just making sure that in different sectors that don't necessarily have those protections, that we have solutions that are also able to engage and afford that same sort of area that unions bring, if that makes sense.
Yes, it does. And actually, just on that, it's nothing to do with the unions, but I noticed just back to the SMEs, I'm doing a bit of work in Barnsley. Alan Milburn is helping Steve Houghton, the chief of Barnsley Council, on looking at economic inactivity. And the SMEs there said that they really need help to sort of group together in a way they haven't done before to cope with what they are seeing coming from new applicants and new recruits that they desperately want to recruit. And they're seeing a baffling array of attitude issues. These are their words: health issues, needing masses of support. And, if you've got a business of 20, 50, even 70, that's quite hard with one HR director. So there's a question there about how these then link together in new formations that they haven't had to before for this reason. Now, there's a nice question here from Jill Rutter. Jill, are you here? Yes. Right, okay. So about geographic inequality? Yeah.
Hi, I'm Jill Rutter. I'm from Learning and Work Institute, and with Royal Society of Public Health and Institute of Employment Studies, we're doing some of the research papers to inform the Commission, and it's really refreshing that you're talking about social capital and about levelling up. But how can we get kind of levelling up in relation to kind of health and work on the political agenda again, and what role in addressing some of these geographic inequalities will levelling up play?
And just to add on to that, I mean, if you look at the health of the nation, the place where it has frayed by far the most is the northeast of England, where it really is eye-watering, actually, and what's happening up there in terms of the disparity between healthy life expectancy and life expectancy. I mean, across the country, Glasgow is even more eye-watering, but the northeast. So I guess there'll be very specific issues in different regions. Employment issues, benefits issues, health issues. I guess the question is how on earth, given the complexity, we can, you know, how important is that for us, and how are we going to address it? Any thoughts on that from all of you?
Yeah, maybe if I start, because I think that one is probably it's worth saying at the outset, you know, some people are like, is it worth continuing with levelling up? There's going to be a change of government. Is it all going to be dropped? And I think the perspective I have, and I was talking to Andy Haldane about it just last week, is that whichever government, whichever flavour, the fact that inequality is at its sort of most extreme for 75 years, you know, and that's been a decline, you know, over that period of time, means whoever is the next government needs to pay attention to this and really understand it. I think probably one of the challenges is that there are still really big gaps in understanding, and some of that has been driven by people having views and perspectives and hypotheses that are untested, that have been used to drive policy interventions. And part of this work, and actually what similarly is going on in the levelling up agenda, is trying to sort of say, well, actually, we need to better understand this stuff. So the research questions that are going into the research sandpit with levelling up are actually looking at, well, what does drive the difference in terms of well-being and inequality across the country, and how much, you know, how can we understand that better? What are the things that are driving difference in productivity across the country? How does that interrelate? And how does the division of government and application of government resources, how does that influence it as well? So I think what's great is that, you know, this realization that with the complexity, there is more that we need to test and understand before leaping to solutions is absolutely right there and centre. And I think that, you know, there are, you know, probably, I don't know how many of you interact with sort of civil servants on a regular basis. You know, they get a lot of drubbing. I find that actually there are some really thoughtful, smart people who really care about that stuff, trying to do some great work. And so I do have that there is the confidence that they're driving decent understanding and work is going to be helpful and aligned to what we're trying to do, because then it lets you shine a light on, look, this is what's happening, here are the opportunities to make a big difference. And I don't know about you guys, but if I was coming to government and someone said, here are the areas where you can make a biggest difference and here are the levers, I'd be like, thank goodness for that, right, let's crack on with it. But maybe that's why I'm not in politics.
Thank you. Just a couple of more questions. I know I did say 5:20, but it's 5:23. If it's okay, just a couple more questions, if that's right, because it's going for 5. There is a question here which is about it's really, there's obviously the health that can be going off in the nation, which is causing some of these trends. But another thing, which I think, Gavin, you alluded to, was the nature of the world of work and what's happened there. And particularly, we know the pandemic pruned back quite a lot of small businesses where individuals could work locally. I was struck again with the Barnsley work. Somebody who had mental health fragility, as they described it, said that once upon a time they were able to work in the local cafe, but always at where the proprietor knew them and could support them. And it was just a stone's throw from their home. But now what's left, that's gone. It's just kind of the warehouse. and they can't cope with being a warehouse operative. It's just too rigid. So I suppose the question is, to what extent do we think the nature of the structure of work is an issue? And if it is, again, is that different in Britain compared to some of the other countries? You mentioned the gig, precariat. Is that going to be a focus? And I wondered whether Beth might refer to that, given... Yeah, thanks.
Let me have a go at that. And I'm glad at the moment that I'm not Christopher in charge of the Secretariat, trying to think how on earth do we get our arms around all these issues? But so stepping right back, what you see if you look at trends over time in the UK in terms of how different type of workers feel about their work and how it relates to the levels of stress and anxiety they feel, best evidence is that we have seen a significant shift basically in the 21st century compared to the late 20th and mid to late 20th century,
right.
Where, and it used to be, really simply, it used to be that if you were a lower wage, someone on low earnings, you would have faced less intensive work demands than a higher earner. That was a massive generalization, but that was the broad trend in Britain in the 20th century. Yeah. That has gone. Work intensification during this century has been overwhelmingly concentrated amongst people who don't get paid that much. Yeah. And that is a big change. Yeah. And that comes across in terms of lots of metrics, in terms of surveys about, like, I feel completely spent at the end of the day, I feel anxious after I leave work, and all that kind of stuff. That has been a really material shift in this country. It is not just in this country, so we're not, we live in a global economy, and some of the trends in work are obviously shared. But I think the impact those type, and a lot of that I think is related to technology and how technology is deployed in the workplace and the kind of pressures that puts people under. A lot of it also comes from face-to-face interaction with other human beings. It's either a lot of interaction with technology, the warehouse, a machine telling you to speed up, or a lot of interaction with other human beings seems to be two of the key drivers. And I think that is less regulated in this country because many of those sectors are less unionized, there's less collective bargaining. Part of our employment law just doesn't cover some of the same issues that it does in other countries. So I think broadly speaking, it's as a 21st century phenomenon to see that level of intensification, and it's playing out slightly differently here because we regulate it less. And we have fewer workplace institutions in the sectors where that bites the most.
Interesting. And then, of course, it'd be interesting to see what artificial intelligence will do to that intensification. Yeah. Beth.
Thank you. Just to add to Karen, I think in terms of for different ways of working, in thinking about remote working in particular, which is obviously a focus area for this, I think one of the things we need to be careful of, and with say current government rhetoric, sometimes particularly in the recent autumn statement around remote working, it sometimes pitches this silver bullet for fixing everything. And I think one of the things we need to make sure we understand is the potential of different working arrangements, but also their limitations as well. And also just understanding the reality at the moment of where we're at. We're nowhere near a place where remote working can be some grand solution. Even as we were mentioning the disability confident departments in the civil service, I think at the time of the autumn statement, it was something like 0.5% of the jobs were remote working or work from home jobs. And of those, I think 100 were part-time. So it's still, in terms of thinking about the different scenarios, we also need to make sure that we have this robust evidence base in place that we can inform that, so that we're using the facts and stats to back the rhetoric and the solutions, if that makes sense. So, yeah.
Great, thank you very much. Now, I feel as if I've rather pressed on your time because we're now sort of 8 minutes over. So I think we should probably wrap up. And I'm very, very grateful to all the panel for their contributions. I'm not going to sum up, but just to say it's a rather dizzying array of issues, let's put it that way. Not just patterns of health, the economy, the short and the long term, the employers, the unions. We haven't even got into benefits yet, what's happened there. We've got the north-south divide, and we have generational issues too. So just a small number of questions for this commission. So we need all the talent we can get for you to help with us and to engage with us. So please, please do. So I want to thank very much our panel members for all their contributions. Thank you all for coming. Thanks also to Chris and the team, to Joe Bibby and David Finch, who are in the Healthy Lives team, to Gillian Connor and the comms team for all their support, so to help to put this event together. Thank you. So the next steps are that the commissioners will meet for the first time off the panel next week. The work with research partners is underway. And as for today, as I say, the event's recorded and you can watch back. And as I say, tell your friends. We'd love your thoughts on the event, so please let us know. We'll share a feedback survey. And more generally, please stay in touch. There are a number of ways which the Commission website will tell you. And there's a place to sign up for regular updates and so on. And there's a Commission Secretariat email address, so please use that as well, and a website, which is commission.secretariat@health.org.uk. So with all of that, I hope that's whetted your appetite for further debate discussion. There's some drinks and canapes at the back. Please join us and network. But many, many thanks, and really look forward to your engagement as we go on to this very thorny and multiple dimensioned issue into the next 18 months or so. Thank you.